Hi, everybody. Welcome back to another episode of the Inspire Health podcast. Today's episode, I am going to talk about something that has been on everybody's mind over the last several weeks. It's actually pretty much all we hear about on the TV or on the internet. It is talking about the COVID-19. I have had a ton of questions over the last several weeks from my patients, and I wanted to put together an episode breaking down some of the most common questions that I have received, and hopefully I can shed some light on some of these things. And so this episode is on the facts, fiction, prevention, and treatment of COVID-19. So I'm going to do this all as a question and answer format. So first question is, what is the coronavirus? So coronaviruses are not a new virus. They've been around for a long time. They are a large family of viruses that cause illnesses ranging from the common cold to more severe diseases such as MERS or Middle East Respiratory Syndrome, and the one probably most people are familiar with, SARS, that we had quite some time back. And COVID-19 is just a new variant of the coronavirus, very similar to SARS, but is a new one that we haven't seen identified in humans before. So for the most part, coronaviruses aren't very dangerous. They can range from very mild to more severe types of injuries. And early symptoms are very similar to the common cold, and even as we would see a lot of times with influenza. So fever, cough, shortness of breath. One of the big differences is that the coronavirus does not seem to be related to runny nose, which is different from the flu. That's a differentiation between those two. But the virus can and does have the potential to lead to pneumonia, respiratory failure, and in some cases, if they are not able to get on top of the infection, it can lead to septic shock and death. So how does it spread? So it spreads primarily, it is transmitted through contact with respiratory droplets rather than through the air, and that it can persist on surfaces for several hours, even up to several days. So we have to be, this is why it's so important to wash our hands. This is why we can't be using community towels or something along those lines to dry our hands on. The virus can persist for several days, so we can pick it up, and then if we touch our face or touch our eyes or touch our mouth, then we can start to infect ourselves. Now, one thing that is quite different with this compared to the flu virus is that the incubation period for the flu is generally somewhere between 1 and 4 days, with an average of about 2 days. So someone could get infected, and then they could pass that infection along over the course of a couple of days. The incubation period for the coronavirus is anywhere from 2 to 14 days, and maybe even longer. These numbers seem to keep changing as we're learning more and more about this condition. But 2 to 14 days means if someone has traveled and they've been in contact, then they need to literally isolate themselves for up to 14 days and possibly for a minimum of 2 weeks, just to be on the safe side that you're not going to still be contagious. So next question, who is at risk and who is not? So like most viruses, anyone can technically get the virus. Different viruses tend to target different groups at times, but the most infections are usually mild, and they are especially mild in children and young adults. I think 19 years old and younger, very mild infections that they seem to get. And if you aren't in an area where COVID-19 is spreading, and you haven't traveled from an area where it's spreading, and if you haven't been in contact with someone who has it, your risk of infection is pretty low. Now, one other thing that is interesting with this COVID-19 virus is that, well, I should say COVID-19 is the disease associated with infection of the coronavirus 2. So sometimes you'll see a SARS coronavirus 2. That's the actual virus, but then when we talk about when someone actually gets infected, then it switches names and it is called COVID-19, just in case you hear these two different things are more or less similar. So similar numbers of men and women have contracted the COVID-19, but men seem to be more at risk for fatality than women. So the death rate for males last I checked was about 2.8% and about 1.7% for women. Now they think that that has to do with the fact that the specific enzyme, this ACE2 enzyme that the virus attaches to, which kind of gets its foothold into the body, into the cell, that is actually from the X chromosome. And so given that men only have one X chromosome and women have two X chromosomes, they think that that might be part of the reason where if there was a problem on one of them, that they would have some buffer because they've got two, whereas men don't have as much buffer. That's as far as we know from that at this point. The people who are most at risk are the elderly, especially over 80 years of age, and those with weakened immune systems or medical conditions like chronic bronchitis or emphysema or COPD, if they have high blood pressure and heart disease, lung disease, cancer, diabetes, obesity. Any of these conditions put the person's immune system at more risk. They will have a harder time being able to fend off the virus. And this group can be at a significantly higher risk, sometimes even a tenfold higher risk than the rest of the population. For the most part, the majority of the population, the risk is not that high, but for the group that is more at risk, it can be quite a bit higher. And this is why we're taking all of these precautions to protect this group of people. So the big question, how bad is it? This is something that seems to be changing from day to day as more stats come in. I've seen the numbers vary substantially depending on what we're looking at and which source it's coming from. It can actually be really quite difficult to know what's really going on, but I'll break down for you at least as far as I know at this point. So when we are evaluating how bad something is when it comes to a virus, we're really looking at two things that we're most interested in. So how infectious is it and how fatal is it? And so the first part, how infectious is it, we use a measurement called the R naught of the disease. And this is a mathematical equation that shows how many people will get sick from each infected person. So as a rule of thumb, if the R naught is below 1, then the disease doesn't tend to be an epidemic. It tends to burn itself out. If it is above 1, then it can often become an epidemic. So, for example, the seasonal flu has an R naught of around 1.2 or 1.3, meaning that every person that gets infected will infect another 1.2 or 1.3 people. To put this into perspective, some other things you might be aware of. So measles, for example, has one of the highest R naught numbers. Somewhere between 12 and 18 is typically cited. Many diseases, everything from the terrifying to the mundane, exist in the 2 to 7 range. These would be things like Ebola and HIV and even the common cold. When we look at coronavirus, the numbers have been thrown out anywhere between somewhere around 1.4 to 3.7, which is fairly similar to SARS and MERS. Both of those looked really scary at first, and they were definitely worth some concern, but neither took over the world like the horror movie scenario that we have often heard. So we're still learning so much about this, and the numbers are changing day to day. But as of right now, it looks like it has a higher R naught value than the flu, which means that it can spread quite quickly, and this is why we're seeing these epidemic proportions. But it's important to remember that it's simply a statistic, this R naught value, and that it's a statistic that describes some of the numbers that we see. It's not a rating of how scary a virus is, nor does it dictate how deadly a disease is or how difficult it might be to contain. There's a lot more information that we need to know in order to make all of those, in order to answer all of those questions. What scientists estimate at this point is that over time, 40 to 70% of our population will likely be affected by the coronavirus. Now, those with a chronic disease will face a greater threat, and in some cases, they will be affected 10 times more than the rest of the population. So this is really important, and this is why we need to protect this vulnerable group. Now, the other thing that we look at to rate how bad this virus is the fatality rate. And these estimates range substantially. So this is of the people that have been infected, how many people are going to actually die? What percentage of the population will die that gets infected? And these have ranged anywhere from about 0.6% to 4%. And the percentage definitely goes up with people that are older than 75 years old. So just for some comparisons, the seasonal flu generally kills far fewer than about 1% of those infected. So numbers are often closer down to around 0.1. Now, the World Health Organization recently said the fatality rate of the coronavirus or of COVID-19 is 3.4%, which is substantially higher than the common flu. But what they don't always mention is that the World Health Organization also is expecting that number to drop dramatically once they understand the full extent of the illness. What's important to remember is that all we could base that on is what has been tested. So many mild cases go undiagnosed. It depends on which cases have been tested and which ones haven't. So in short, we don't know the true fatality rate for another year or more. And a lot of times, even throwing around fatality rate is kind of useless at this time, but it will be helpful sometime next year once they have all of the statistics in. If we were to try and look at what would be the probably best example to try and get an accurate fatality rate, it would be looking at the Diamond Princess cruise ship, because all of the 3,500 people on board were tested. And so far, we know about 706 have tested positive for the virus and 6 have died. And that would leave a case fatality rate of about 0.85%, which is was about 8.5 times greater than the average flu, but that's still in the realm of what a severe influenza epidemic would be like. Now, one other way that I've seen the numbers on it to try and understand it a little bit better is, a lot of times these are being compared to the flu, and some numbers tell me that the flu is much worse and much more vast, and others are saying that COVID-19 is much more virulent and much worse. So the numbers that we just talked about would make it sound that COVID-19 is definitely more severe than the flu. Another set of numbers that I've recently seen was looking at the percentages that actually become critical cases. And so with COVID-19, it says about 10 to 15% of mild to moderate patients progress to severe. And of those, 15 to 20% progress to critical. So what this breaks down to is that the critical cases of COVID-19 amount to somewhere around 2.25%. Now, assuming that the death toll among that 2.25% is not 100%, the probable death toll from COVID-19 could be far lower than that for critical cases of common influenza. So if we look at the 2018-2019 flu season, as the CDC reported that there was 900,000 people were hospitalized in the US and more than 80,000 people died from the flu. So that's a fatality rate of just shy of about 9% for critical cases of the flu requiring hospitalization. And of that, the vast majority of that were all elderly as well. But that is much more significant than the 2.25 of COVID-19. So again, bottom line is like none of these numbers are great. And when you have any of these types of viral infections, unfortunately, there are going to be losses that are going to happen. And we're just hoping that we can minimize the losses as much as possible. So this brings us to the next point is, what are the ways that we can control epidemics? And there's essentially 4 ways, and we're going to break down each one of these in a little bit more detail. But the 4 ways that we are able to start to control epidemics are: 1, prevent the herd infection by massive social isolation, which is what we're currently doing. Number 2 would be prevent the infection with a vaccine. Number 3 would be prevent the infection by using non-toxic prophylactic treatment. And number 4 would be let the infection happen and support the system during the illness. So let's go through each one of these. So the first one, prevent the herd infection by massive social isolation. So this is when everything is put on lockdown. We are told to stay at home, everything shuts down, and we basically just try to stay in our homes and avoid social contact until the virus runs its course and that no one else is going to be able to get infected. And so this is currently what's going on in pretty much most places in the world right now. Now, this can work, and it can be an effective way to really mitigate and slow down spread and let it start to die off. But there are a lot of consequences to this. So a lot of times this means healthcare. There's no healthcare. We start to run out of food. There's no deliveries. There's no electricity. There's no water. All of these things depend on people showing up for work. So there's massive economical problems that can happen with as well, and it can only be done for so long. But it can be a very powerful tool. So this would incorporate things like social distancing. So this is where we don't shake hands. You try and prevent the spread as much as you can. Keep at least 6 feet radius from others, unless they're healthy and uninfected people who live in your home. So this is where all of the inconveniences that we have to rise to the challenge and meet. We have to cancel vacations, cancel business trips, restaurants shut down, bars shut down, don't go to your yoga classes or your fitness club. All of these things should shut down, and we basically work from home if we can. So this is something that I'm currently doing. Now I will be doing only telemedicine until further notice, to do my part for preventing the herd infection through this massive social isolation. So we stay at home. And since everything is shut down, it's been recommended now to not get into gatherings of any more than about 10 people. So stay at home. Use it to get caught up on other things that you can get caught up on. Spend time with your family, read a book. Basically, do what you can to stay at home and change the patterns of what you were doing prior. This is a really good opportunity to do something very different, and it's sort of a forced opportunity that we probably would not have taken on our own. If the whole world started to stay at home for 14 to 21 days, it would make a significant slowdown in the pandemic. Now, it doesn't necessarily mean that it would completely go away. You have to think about it like this: even if the same amount of people would eventually get infected, but it took a longer period of time, it makes it much more manageable. Where a lot of these problems happen is that if you get massive groups like what's happened in Italy that are getting infected, and then it completely overruns the medical system, hospitals and ICU units, and all of these first line essential medicine and essential personnel, they get overrun, and then that's where we start to run into problems. If you can titrate it down and slow it down and even let it still, if the same number of people got infected but it went over a longer period of time, it's just so much more manageable, and that in itself can prevent a lot of unnecessary deaths. So number 2 is prevent the infection with the vaccine. So I think right now there's companies hard at work trying to make a vaccine, and there's a few problems with this. First of all, the vaccines are rarely ever are they completely effective. The track record of success is really not so great when we look at it, especially if you look at something like influenza, for example. The influenza is an epidemic every year for the most part. And the vaccine is somewhat effective. It varies substantially from year to year. The other thing is that often vaccines show up on the market when the illness is almost gone. So most of the time, these vaccines, by the time they've run the course and they've done human trials to determine safety, usually it's 12 to 18 months after the virus has really hit. So we will likely have a vaccine in the following year. Now, the other problem with the vaccines is that these specific viruses, especially coronavirus, tends to remodel its DNA in its genome all the time. So this is same as like a flu virus, why we have to always have a new vaccine, and it depends if it's catching the right strain or not, as far as how effective it will actually be. If we do get a really good one that's safe and effective, then there definitely can be a group in the population that may benefit from it. But for the most part, that's not the most viable option at this point in time. Number 3 would be prevent the infection by using non-toxic prophylactic treatment. So this is where we look into the world of really supporting our immune system, building up our immune system using herbs and plant medicine and nutrients and vitamins and minerals that are all have effects on trying to be either antiviral or boosting our immune system so that we can boost our innate immune system so that we can fight viruses off more effectively. I'm going to go into this one in much more detail in just a little bit. And the fourth one is to let the infection happen and support the system during the illness. So this would be an example of what is done with, say, chickenpox, where you used to get children together with an infected child and they would all get sick. They would be supported. You would support their immune system as best as you can, and then they would have lifelong immunity to that specific strain of the virus. Now, this ultimately all depends on how healthy one's immune system is if they are able to tolerate that. And it also depends on how virulent the virus is. This is not going to be a good option for a decent percentage of the population. But for those that have already gotten ill, have been infected, and have recovered, they now have full immunity to this specific strain of the virus. And if you get enough people that get infected and recover, that actually creates a very strong herd immunity that which will protect the elderly and the ones more at risk. Okay, so next question is, what are some of the current precautions that we can take? So most of these are pretty straightforward, but number 1, practice good hygiene. Almost the most important thing you can do to try and prevent the spread is just washing your hands for 20 to 30 seconds with soap and water. Hand sanitizer is still a good option when you're out, but for the most part, if you are washing your hands regularly, even if you're out, try as best you can to still frequently wash them. And then the hardest part of this is, as human beings, we are constantly touching our face. We rub our face, we put our fingers in our mouth or our eyes. We're always sort of got our hands up around our face. And so if we can be really conscious about that and avoid touching the face, that also helps a lot. Now, most people don't wash their hands for anywhere close to as long as they should. And 20 to 30 seconds feels like a long time to wash your hands if you are not used to doing it. So one of the things I read a little while ago that I thought was a good way to think about it was hum the birthday song, Happy Birthday, 2 times in a row, and then you have likely washed your hands for that 20 to 30 seconds. It is recommended by the CDC for specifically people over 60 to stay at home and avoid any unnecessary contact. If you have elderly parents, find ways to help them out. Get food for them, get supplies. Try and have them stay at home as much as they can so you can be the one to go and bring it for them. If they have any kind of susceptibility with a underlying chronic illness, autoimmune disorder, if they're on any types of medications that are immunosuppressive, if they have cancer, transplant medications, all of these things, they should be staying at home and not risking going out at all. We are all engaging in social isolation. The other question a lot of people have been asking me is if wearing a mask will be helpful or not. And for the most part, wearing a mask will not help protect you from becoming ill with any viral infection, coronavirus included. The only time someone would really benefit from wearing a mask would be if you were actually ill with COVID-19 symptoms, especially coughing. Or if you were looking after someone who may have COVID-19, then you would be advised to wear one. Otherwise, walking around with a disposable mask, for the most part, is taking away supplies to the group of people that really need it most. And it's not really going to help you. The viruses are still going to get in. There's holes in the sides of the mask, unless you've got the specific ones that have almost like a vacuum around it, but that's not the one people are using. And if you're not ill or looking after someone who is ill, then you're wasting a mask. There's a worldwide shortage of masks right now, so the World Health Organization is urging people to use masks very wisely. Another thing that has come up several times, and this is a really interesting one and probably a bit of a controversial one, but is being advised to protect yourself by still getting the flu vaccine. Now, this is really interesting because I was looking at some research on this, and in a paper in the prestigious journal Vaccine, there was a study called Influenza Vaccination and Respiratory Virus Interference Among Department of Defense Personnel During the 2017-2018 Influenza Season. Now, what this study was looking at was looking at a phenomenon that's called vaccine-associated virus interference. So this is essentially when a vaccinated individual may actually put themselves at a higher risk for getting other respiratory viruses because they didn't receive the non-specific immunity that's associated with a natural infection when you actually get the condition. So basically, even if you get some protection from the flu, and often even a couple of other viruses you might get some protection from if you have the vaccine, but you may also be increasing your risk of getting other types of infections if you have the vaccine. So this is a really interesting study. And what was fascinating about it was that the study showed that if those that were vaccinated had a 36% increased risk of getting coronavirus and a 51% increased risk of getting human metapneumovirus if you were vaccinated. So after reading that study, it's kind of trying to weigh out the odds of whether or not you get enough protection to try and avoid the flu, but you sounds like you are definitely increasing your risk of potentially catching the coronavirus. And for those of you that are watching this, this is the study. I'll pull it up right there. This is the study from the Journal of Vaccine. I'm looking at this through, Elsevier. And receiving influenza vaccination may increase the risk of other respiratory viruses, a phenomenon known as virus interference. Vaccine-derived virus interference was significantly associated with coronavirus and human metapneumovirus. So it makes me question whether or not that's advisable at this point in time. At least from reading that, it makes me think maybe not the wisest decision. So what can we start to do? In my mind, the thing that we can all start to do that would be beneficial for ourselves and for everybody else, on top of right now doing the social isolation, because if we're going to do that, everybody has to do it to make it work. But we can all build and support our innate immune system. Supporting our immune system is key. The people that are most susceptible to it are the ones that have already dysregulated or weakened immune systems. Our immune systems tend to weaken a little bit as you get older. There's certain things that set in motion that cause the immune system to weaken a little bit. If you have any of the pre-existing conditions, you are going to be more likely at risk. So obesity, diabetes, heart disease, smoking, immune compromised. These are all susceptibilities. Other susceptibilities are things like poor diet, sugar, allergens, refined foods, chemicals, additives, alcohol. All of those things have some effects on weakening your immune system. So when we talk about building our innate immune system and building some innate protection, I think about this as resilience. And to build resilience in the body is a combination of two things. You have to be able to pull back the things that are making your body weak and build back up the things that are going to make your body strong and supportive. So what do we need for an immune system to function properly and be strong? We need clean water, we need fresh air, we need clean food, we need good nutrition, we need to get proper sleep, manage stress, and move our bodies. Those are really the essentials to healthy living. So at this point in time, I would be incorporating as many of those things as I can. I'd be drinking lots of clean water. That's really important because as soon as we get dehydrated, we also increase our risk of getting an infection. We need to keep hydrated in order to support mucous membranes in our lungs. Clean water is really important. Clean air, getting fresh air. We're actually better to get certain fresh air than being locked up. Fresh air is fine as long as we are not within a 6-meter radius of someone that is infected. So going out to the park and doing all these different things, getting fresh air, you're better off to get fresh air than stale, stagnant air in your home, as long as you're not getting into a place of groups of other people that might be infected. Healthy nutrition is a cornerstone. Healthy nutrition and clean food. These are cornerstones, a whole food diet. Incorporating more vegetables, alkalinizing foods like bone broth, incorporating fermented foods. Some foods have really powerful antimicrobial properties, incorporating things like garlic and onions and as many natural spices as you can put on, turmeric and oregano and basil and paprika and all these things. Anytime you can use natural spices, they have an array of different immune boosting chemicals in them. Sleep is a huge one. For me, that's probably one of the most important ones. If I start to lose sleep for too long, I can feel my immune system weaker. And as soon as I get better sleep, I can feel it much more resilient. Stress management is a big one at this time. One of the biggest things that pushes our fear buttons is uncertainty. And when we get inundated with information around these viruses, whether it's completely real or not, it's just uncertain. We don't really know, and we don't know what the full extent of all of this is going to be. But it creates a lot of worry and it creates a lot of uncertainty. And so when we start to get uncertain, we start to kick in that fight or flight response. And over time, that definitely starts to weaken our immune system. So do things that are going to try to balance that back out as much. Do yoga at home. Do deep breathing exercises. Do meditation. Go for walks. This type of stuff is all really important and makes a really big impact. What you're basically trying to look at is just pulling logs out of the fire. Like whatever things could be creating some troubles, the more that you can pull them out and get rid of them, you just have more resilience and more buffer to manage what's in your world. Go for walks regularly, move your body. That's super important for the lymphatic system, which is a big part of our immune system. Lymphatics move through muscle contraction and valves. So by muscular contraction, we're moving lymphatic tissue throughout our bodies. This is what scavenges and picks up and looks for all the different bugs that we might be picking up and helps to support our immune system. We got to remember too that then the things that are more susceptible are when we have these other conditions that we've talked about in many times. So at this point, sometimes changing things like diabetes and obesity and heart disease are a little bit tricky, but what you can do is focus on building up those things that we just talked about, getting more clean water, getting fresh air, whole food diet, bone broth, fermented foods, garlic, onions, getting more sleep, moving the body, managing stress, doing meditation. Do all of those things you can to build up your immune system, and then remove the things that you can. Probably number one on the list would be sugars. I would get rid of refined sugars as much as you can. Now, little bits here and there can be fine, but sugar can dramatically lower your white blood cells for hours after ingestion. So if you are already, especially if you are already on the more susceptible list to get an infection or to be susceptible to a virus, sugar is going to increase your chances of getting that virus. So I would remove all of these sugars. I would look at removing refined grains Okay, same sort of thing. Refined grains are very much like refined sugar. Get rid of foods that have a lot of added chemicals and additives, and try to remove alcohol for the time being as well. So part of it, we wonder, I've been asked, are viruses just getting more and more virulent every year? And are we just setting ourselves up for bigger and bigger problems coming? And I don't think anybody knows the answer to this question for sure. But what I also notice is that our population is getting bigger every year, and we're living longer, and we're living with more chronic disease than ever before. We have more obesity, we have more cancer, we have more heart disease, we have much larger population that is going to be more vastly susceptible to these types of viruses and infections. So from my point of view, what we can always be doing is working on supporting our overall health, building our innate immune system, supporting ourselves with the fundamentals of healthy living so that we can just increase our resilience so that we don't become a hospitable ground for a virus to get a foothold. Now, one thing that I wanted to talk about too, that you can do in addition to all of the stuff I just finished talking about when it's related to the immune system, is looking at very targeted nutritional therapy and plant-based therapy. So some of the things that are the most important ones would be vitamin C. Now, they're actually doing trials. The Shanghai government officially recommends vitamin C for COVID-19. They're actually conducting a few different trials now on vitamin C with success. Now, they're doing intravenous vitamin C, and they're doing it at a dosage that they're recommending is around 50 to 200 milligrams per kilogram of body weight. And orally, it's being suggested a minimum of around 3 grams a day spread throughout the day. Now, remember, vitamin C has got lots of literature on it for preventing and supporting moving through symptoms faster from viral infections, even speeds up the common cold. It's got a lot of literature on it and been time tested for a long time. The key is dosage. Vitamin C definitely improves with higher dosage. So the range can go for a long way. There's a big safety profile for vitamin C, but I would recommend at this point a minimum of 3 grams a day. Personally, I'm doing more like about 6 to 8 grams a day. You got to spread it out. Don't take it all at one time. Vitamin C tends to go up in the blood and then it comes down after a couple of hours or 3 hours or so. But just fill it up, either capsules or in your water, and just take it throughout the day with lots of water. The other nutrient I think is probably one of the most important one is getting your vitamin D levels optimal. This is one I like to check on people. It's notoriously low, especially in winter where we live in Canada. But there's been a number of studies showing vitamin D. People with vitamin D deficiency are 11 times more likely to get a cold or flu, while supplementing with vitamin D can reduce colds and flus by 42%. There's another big study in the British Medical Journal in 2017 looking at vitamin D's effectiveness against viral infections, and researchers analyzed 25 clinical trials. This was a big meta-analysis that included 11,321 people. The data came back from 14 countries including US, England, Japan, Australia, Canada, and Italy, and basically showed that vitamin D supplements cuts in half the risk of respiratory infections caused by viruses. Really important one to keep up at this time of year. And ultimately, I think it's important to get your blood levels checked. There's lots of recommendations for dosages for vitamin D. I've seen big ranges from 1,000 IUs a day to mega doses for short periods of time. Ultimately, it's individual, and it's one that you should be talking to your practitioner about. And vitamin D ultimately should be balanced with other nutrients. It works best to be balanced with K2, magnesium, and vitamin A. Which leads me to the next vitamin that I think is incredibly potent for as an antiviral, notoriously low in people, as is vitamin D and vitamin C, and this is vitamin A. Vitamin A plays a huge integral role in the mucus layer, both the respiratory tract and the gut lining of the intestine. It also promotes mucin production, which it improves part of the immune system, this antigen non-specific immunity function of these tissues. If you're deficient in vitamin A, it tends to cause troubles with T cell maturation and antibody-dependent immune system, these two different branches of our immune system. And it shows to have problems with lowering macrophage. And when people have died from COVID-19, it's usually what ends up happening is it's called a cytokine storm. So essentially, it's not the virus that really damages you. It's the virus takes over your cell's machinery, and then you get damage and you get inflammation. And if you can't get rid of the infection, the inflammation just keeps building, and eventually you get this huge cytokine storm, which can create sepsis. And one of the things that vitamin A does is it helps to downregulate the cytokines that can cause that cytokine storm. So this is one of the ones that I'm taking currently and giving my kids. A really easy way to get it in is through cod liver oil. Just make sure the cod liver oil has vitamin A and also vitamin D. Those are actually natural within cod liver oil. And it was recommended through some other resources at about 5,000 IUs a day for vitamin A. And also very important to remember that if pregnant, do not take vitamin A. A couple of the other things that I think are really important is taking zinc. I like the Formin zinc picolinate. Zinc's a huge nutrient too, very often deficient. One of the studies that I looked at around zinc was it showed that plasma concentrations of zinc that were greater than 70 micrograms per deciliter, that group had a significantly lower risk of pneumonia requiring antibiotics than did participants with much lower, under 70 micrograms per deciliter in their plasma zinc levels. So keeping your plasma zinc levels up has a really powerful effect on your immune system. And that's been known for a long time. It's an important nutrient in many things, 300 enzymatic functions in the human body. Many of them have to do with modulating and supporting the immune system. The last two things that I would recommend would be antiviral herbs. Now, you can get into tons of different formulations for this. I'm currently in the process of trying to put together the right amounts of these different nutrients specifically as a strong antiviral that'll incorporate some of the different nutrients and the herbs. And I'll keep you posted once I'm able to actually finish the compounding that. But some of the key antiviral herbs that we would use would be things like astragalus and skullcap and licorice root, sambucus or elderberry, rhodiola, andrographis, cordyceps, and there's many more. And they all have slightly different effects, but all very powerful ones to incorporate. And then one of the most recent ones that I started using, and I really have found it to be beneficial, even just in offsetting cold and flu season for myself and my family, and I have two little girls too, and a teenager. And so I give it to all of them, and that is a bee propolis spray. So I've really found that to be beneficial. There's a lot of literature on the antiviral effects of propolis, and I like the throat spray one too. So I will take and I'll do 4 pumps a few times a day and just spray into the back of my throat, and that acts as a very powerful antiviral as well. Depending on who you follow or who you're looking for advice from, you will hear lots of different suggestions for nutrients and vitamins and minerals and plant-based medicines to support viruses. These are some of the main ones that I think are really effective and that I use personally. So in closing, I hope that this information had some value for you. I hope that it answered some questions that you might have had. I will do my best to stay updated and bring more information to you as I hear more. And in the meantime, stay safe, stay inside, and do everything you can to build your natural immunity. That is going to be your best defense against any virus, any bacteria, any kind of chronic disease. Be well.